Hi, my name's Jeremy Hawke. I'm a podiatrist from Hip2Toe Podiatry in Cairns. How are you? I'm here to talk to you today about medical acupuncture, or also known as dry needling, and what some of the advantages of dry needling are. The first advantage is it's relatively low in pain to actually have dry needling, very similar to traditional Chinese acupuncture. And what are the expectations from having dry needling? Well, firstly, the one expectation that I would expect you to notice is a reduction in pain if you're suffering from chronic pain. Chronic pain can be in different areas of the body. You may have it in the buttocks area, you may have it in the hip area, you may have it in the hamstrings, calf muscles, or down the front of the legs, or somewhere in the feet. Very often the pain can be accompanied by cramping. You may notice shooting pain going down the sides of your legs. You may notice a big band of pain across your back that's actually related to the hip pain that you're having. Very often these types of chronic pain can be associated with motor vehicle accidents or motorcycle accidents, industrial or occupationally related accidents, or even chronic diseases, where osteoarthritis has taken place, rheumatoid arthritis, or even muscular diseases. Very often these diseases or conditions are accompanied by chronic pain. You're probably wondering why you should come to see me. You may have been to many medical specialists. You may have been to different medical specialists who've given you tests, ordered ultrasounds, MRIs, CT scans, bone scans, x-rays, and found very little, and come back to you and said, well, there doesn't appear to be anything wrong, and therefore I don't think I can do anything for you. Well, very often what hasn't been found are what's called myofascial trigger points. And myofascial pain can actually create regional pain that's distributed further down from where the actual source of pain is. So, if I can describe to you, you may have a trigger point or myofascial trigger point taking place at a neuromuscular junction where the nerves actually meet the muscles. What I'm able to do at this myofascial trigger point, where the two meet, you may have a lot of muscular spasm taking place. I can take an acupuncture needle, bring it down into that myofascial junction, and what we can do is actually release that pain. You're wondering how many treatments it would take? Well, it varies from person to person. It's very hard to say why myofascial trigger point pain starts. There can be 120 different reasons why it starts, and it varies from person to person as to how long the pain's going to be there. If you come to be treated by me, you may notice a difference even after one treatment. Very often I've had patients come in to see me with, for instance, chronic hip pain that's been maybe 9 out of 10 every day, night and day, 24 hours a day. They've had that pain for anything up to 7 years. They come along and had one treatment and come back to me very often a week later and said that they have 0 out of 10. They don't actually have any pain. I'm not saying that everybody will have exactly the same outcome, but that's the outcome that we can work together towards. So please, if you do have that type of pain, come and see me. If you need to come from interstate or overseas, give us a ring at our surgery, and we can also arrange for the best referral for accommodation. I look forward to meeting you and look forward to working with you and moving in the direction of reducing your pain and increasing your quality of life and overall your happiness and health. Thank you very much.